done endocrinology and toxicology with LCMS for a while. Our primary reason for using it at Kaiser is we've been doing for many years drug confirmations using GCMS, so we're transitioning that technology to LCMS, and we also find the need that a lot of the immunoassays we have for endocrine analyses, particularly steroid, they're not sensitive or specific enough for what we want, so again, we're moving some of those to LCMS.
My focus is on education in forensic science and also research and training, and I got involved in this technology because I want to be able to see many different analytes at very low levels.
I work in the chemistry department, and the reason that we wanted to bring mass spec testing in was to look at specifically for steroid analysis initially, so for low-level testosterone and low-level estradiol analysis, and then see what happens after that.
We wanted to bring in mass spectrometry, so first application would be steroid analysis.
Dr. Stone, you talked a little bit about the reasons why you went with LCMS. What were some of the challenges you had to overcome to implement it in your lab?
One of the chief difficulties was people switching from a technology they were familiar with, GCMS, to LCMS, somewhat different hardware issues. One of the primary ones was software issues, and that was overcome for us to a great deal by using the Clickwood software, that because we have people who work in maybe 5, 6 different areas, so we can't expect them to know a range of different highly complex softwares and work in a production environment.
I did my training in a lab that already had mass spec, and then I had to bring in mass spec testing to a lab that didn't have it. But just, going from people used to immunoassay analyzers or chemistry analyzers and trying to, this whole new mindset of how to work in mass spec and how you have to be really careful with what you do and things like that is hard, and the software is another issue. But like Judy said, the Clickwood is of great use and when you're trying to train people who've never had to use the analyst software.
We're still working on getting people comfortable with the technology and making sure they can comfortably use it, and that's one of the reasons I focus on the education and training.
On the point of the technology, how would you say the technology has evolved since you first got involved in LCMS, and where do you see it going, say, over the next few years? Dr. Stone?
Fairly simple, I would say it's now faster, more sensitive, more automated. It seems to me whenever you go to a meeting, everybody always needs to scan faster, be more sensitive, easier to use, and cheaper. So.
Well, I started in a private CRO using LCMS actually, and we had some 4,000s and some 5,000s, so already top of the line at the time. But yeah, same thing as Dr. Stone, sensitivity becoming better, and I'm sort of, we have a 5,000 now, so we have a really good instrument and we're really happy with it, but then you look and see what's coming out, and the Select Science source is really exciting, and new technologies that way.
As my colleague at one of the private labs says, we have the Lamborghini, and he says with jealousy, but it's not because we're rich or anything like that. We just made that decision because of the nature of the analysis we wanted to do. So I haven't seen any evolution in that area over the 2 years, except that the 5500 Q-trap has the Q-trap, but the same sensitivity. But what Grace alluded to was that the Selexion would allow us to accomplish something that we've had trouble accomplishing in regular chromatography separations, and that is separating very similar molecules from one another.
I find that I love the source. I love the front end of the instrument, the way it's very robust, and I think that that's something that's a huge strength. And of course, we see this drive towards greater sensitivity.